Hello, today we're going to talk about Chapter 21, the diseases of the genitourinary system, and this corresponds to Chapter 14 in the code book. The term urinary tract infection is used to cover many things, and I have listed here the three things that you'll see most commonly as infections that are referred to as urinary tract infections. The codes for UTIs differ in that some include the name of the organism and some do not. So when there is no subterm for that organism that causes the infection, we have to code the condition and then have an additional code from the categories B95 through B97. We're going to look at three exercises that look at different ways you would code a urinary tract infection or anything that has to do with the urinary system that has the infective organism as part of the diagnostic statement. The first one, exercise 21.1, number 1, is a urethral stricture due to the gonorrheal infection. And here's an example where you do have the code including the infecting organism. And here's your pathway. And I have just a word of caution there to be careful when you're choosing your subterms, ureter and urethra and urinary. Really have to be careful that you're reading those terms correctly, and there's many indentation levels under these terms because it's such a large system. So be sure you are following your indentations carefully. Exercise 21.1 number 2, you have the group B strep, but it is not included in your code description, so you pretty easily find the abscess of the scrotum. And then when you start looking for that additional code, you're going to start with the main term streptococcus in this case. And also notice that you can code just to streptococcus, or you can code more specifically to streptococcus group B, so be sure you're following that carefully. And this one, number 3, is a little bit more challenging in that you cannot find the main term Helicobacter. You would have to start with infection. So you'll just learn as a coder the different ways you're going to find code. Sometimes it's not as explicit as it is other times. But you can remember that when you're coding that additional code, when you have an infection, no matter which body system you're talking about, it's in the B95 through B97 category. So if you're finding a code that, say, it's an A code, you know that's not right, because it needs to be in that B95 through B97 category to be cause of an infection classified elsewhere. This exercise, number 5, I've included because of the different ways you have to find the manilia. Manilia and candidiasis are used interchangeably. You'll see both in the literature or in the medical record. And I would recommend that you look at the B37 category in the code book and look at all the different infections in the body that can be caused by candidiasis. For women, it's very common to have a yeast infection, a vaginal yeast infection, but you can have yeast infections anywhere in the body. So that's why that B37 category might be a good one for you to look at. I have the pathway here on the right that you can find how I eventually got to this code. There's a lot of steps involved when it's not very explicit which way you're going to start, so you just start looking and follow your see also or see this or see that until you finally get to the code that you need. And here is an example of a urinary tract infection due to the candidiasis, and you actually it refers you to candidiasis. When you go there, though, you find that there is no subterm for a urinary tract infection. The closest is the urogenital site, so that's the code that I chose. Hematuria is something that is integral to any urinary tract infection. Sometimes the blood is microscopic, meaning you can only see it with a microscope. Sometimes you can see it with the naked eye, and that's when it's what's called a gross hematuria, like if the urine is red because it's so bloody. If the provider is documenting that hematuria is excessive, then you would code the gross hematuria, but otherwise you just know that Hematuria is integral to any urinary tract infection, and you do not code it. Urinary incontinence is something that can occur in both male and female patients. You see it in women primarily because of childbearing, and in men following prostate surgery. Urge incontinence is just when you can't hold it. That's something very common with aging as well. And a patient can have a mix of the stress and the urge incontinence. You can also have incontinence due to cognitive impairments or physical mobilities or immobilities. That is an R code, not an N code. You can have urinary incontinence of non-organic, meaning it's more of a mental health, behavioral issue. That is an F code, F98, enuresis, not due to a substance or a known physiological condition. But no matter what is causing your incontinence, if you know what that underlying cause is, that is coded first, and then your urinary incontinence code. Chronic kidney disease, we've looked at it in a couple of body systems. It's important to remember that that develops as a complication of other diseases. And your coding handbook mentions the diseases here that are on this slide. And how you sequence those codes is going to be based on your instructional notes and your excludes one, excludes two notes in the tabular once you've found your code. Stages of CKD are based upon the glomerular filtration rate. I have here the components of that calculation, how the doctor comes up with that. But basically what happens is as your kidney disease gets worse, your glomerular filtration rate number goes down. So that is how these stages, stage 5 is worse than stage 1, for example. When you get to end-stage renal disease, it's important to remember that's the last stage, and the patient either has to go on dialysis or receive a kidney transplant to continue to live. If a patient is getting end-stage renal disease and dialysis, you must remember to add that Z99.2 code anytime you report that. And this last bullet point, you might see in the medical record that if a doctor has documented that a patient is stage 5 but is requiring chronic dialysis, the coder is not going to code stage 5. The coder is going to immediately go in and code the end-stage renal disease in 18.6 and the dialysis Z99.2, following the instructional notes that's under the excludes one note there at 18.5. So just as there are times when a coder can make a decision that isn't based on the provider's documentation, and this is one of those times. I've added a few slides about dialysis because unless you've known someone who's been on dialysis or worked in the field, you may not realize all that goes into that. Hemodialysis. Hemo is blood. The blood is allowed to flow a few ounces at a time through this filter, and then it's returned back to the body. And a patient typically has to go to a dialysis center 3 times a week, 3 to 5 or more hours each visit, so it's very time consuming and life altering for someone to have to be on hemodialysis the rest of their lives. When a patient is going to be receiving hemodialysis, a AV or arteriovenous fistula is created by a surgeon because you need a very strong vessel that's going to be stuck repeatedly. Each time they have dialysis, there's going to be needles inserted in these veins. So unless you have really made a stronger than normal vein, it's not going to withstand all those sticks. It typically requires 2 to 3 months for that fistula to develop. So a patient may have to wait until that's developed before they can actually start the dialysis. So it's something that it's just part of it to have to get the fistula, and it is obviously probably not a very comfortable thing for someone who has to undergo dialysis. Here's an image I found on Google Images that shows that the dialysis nurse would have 2 needles inserted into the patient, into that vein. One is carrying blood from the body to the dialyzer, and the other one is carrying the filtered blood back to the body. In peritoneal dialysis, you've got this cleaning fluid that flows through a tube into the patient's abdomen and then pulls it back out after it's been filtered. Many times patients can do this independently at home. It doesn't involve all those hours at a dialysis center. But there's lots of reasons why a doctor might say the patient has to have hemodialysis or has to have peritoneal dialysis. It's the physician's decision which one works best for any particular patient. I wanted to just remind you about Google Images while I'm thinking of it. Anytime you want to see something, whether it's a disease process or a procedure in the hospital, a medical procedure, if you go to Google Images and search for that image, you're going to find hundreds of them, and you can just scroll through them. Because I'm a visual learner, anytime I see a picture like this or any other one, it helps me remember something about that process or that procedure or that body system. So I encourage you to take advantage of Google Image just to kind of help you with your learning process. And here is an exercise that has to do with that AV fistula. This one calls for a stenosis, and I chose this one to show you because I had a little bit of difficulty figuring out how they've coded it. They have gone in, I realize it's a complication of a procedure, so I started with complication, but the only thing that came close to giving me the right code was the catheter, and I found that primarily by looking at the subterm dialysis. So another example of how you really have to get very familiar with your code book and reading above and below any given main term to be sure you have chosen the most specific code you can find to describe a given situation. And here's another example that talks about the end-stage renal disease with hypertension and the dialysis status. And you notice that stage 5 chronic kidney disease, the hypertension because of that is the first code. That is an assumed relationship between hypertension and renal disease. You find that there's two different pathways there on the right that you could get to that I-12.0, but be sure that you include the end-stage renal disease and the dialysis as additional codes. Let's talk for a bit about BPH. Benign prostatic hyperplasia. You may also see it called benign prostatic hypertrophy. Either way, it's an enlargement of the prostate gland. The prostate gland is typically just a walnut-sized gland, very small, but the urethra goes right through it. And so when that prostate gland gets larger, the urethra is compressed, like you see here on the right in this image, and it causes all kinds of lower urinary tract problems for a gentleman with this problem. When you're coding BPH, you're going to see it without LUTS or lower urinary tract symptoms, that's N40.0, or with LUTS, N40.1. There is an instructional note under the N40.1 code that says use an additional code for any of these symptoms, and these are all taken right out of the book to show you all the things that might happen. It's very uncommon for someone who has enlarged prostate to not have these lower urinary tract symptoms. In fact, I've never coded someone that didn't have them. But I guess if it was early enough in the process, they may not have all the problems that they can have now. But these prostates can get as large as grapefruit size, which I can't even imagine how uncomfortable that would be. But that's why you get all those problems, because it's compressing the urethra. And here's an example of benign prostatic hypertrophy with urinary tract symptoms, and we follow our instructional note to use additional code with an urinary obstruction. As with all of our PowerPoints, remember that I'm only doing some of the questions and some of the guidelines. Any exam question can relate to all the guidelines, and be sure you follow your assignment schedule. Please post any questions in the discussion board, quoting from me the path that you used to try to answer a question. And I like when you do that, because that way all of us can look at the discussion and the conversation back and forth to be sure we all continue to learn. Thank you so much.